Welcome, everyone. This is the first LYP connection of 2021. We have a special LYP connection for you today. We have Irene Martinez from University of Massachusetts Amherst, and she's also the co-chair of the scientific committee for the Latino Caucus for Public Health. We wanted to take this opportunity to give you all the resources you need in order to submit a successful abstract for APHA. And with that, I will get off screen and let Irene speak for the next few minutes, and not few hours, few minutes, and then if there's any questions, we will allow questions at the end.
You could even ask questions in between because we're a small group. Yeah. Okay, so thank you so much, Andrea. This is my second time doing the APHA abstract submission presentation, and I hope that it's useful. It's supposed to be a little bit hands-on too, because I'm going to walk you through the process of how to submit an abstract through the APHA Confax system, which can be a little bit onerous. Even the most seasoned PIs have made mistakes when they were making their submissions, and there's been times where we've had to hunt for their original submissions through the system. So I always think that this is a good refresher for me too, because it forced me this morning to actually submit a dummy abstract just to see what changes, because APHA also updates their software every year. So I think this is a really good practice for me as a scientific co-chair, but also for you all. Even if you have experience, I really think that this is a useful webinar, and I hope that you can get something out of it. If anything, at least besides walking you through the process of how to submit an abstract, also learning about how the abstracts are reviewed. I think that, we're trying to encourage a lot of transparency in the caucus. And so I also wanted you to know how people who are the peer review blinded reviewers, how they're doing it, right? So what are the criteria that they're using to evaluate your abstract? I always think that's healthy. That's always useful to know, because people will ask, why was my abstract waitlisted or rejected? I think that this is useful for people to have. But the truth of the matter is that the caucus scientific program is pretty small. We usually get 9 to 10 sessions a year. And we'll have an average of about 85 abstracts per year. But we try to accept as many as possible, given the fact that our meeting was made all of a sudden virtual last year and we had lost a session. We could only really accept 72 abstracts. But this year, because we're hybrid, hopefully we can go back to 85. The other thing is that we wanted to give you some tips and tricks about what are the best practices for submitting your APHA abstract. What are ways that you're going to definitely earn higher points on your review and find ways to secure your placement in either an oral or a poster presentation or a roundtable. And then at the end, so I'll try to walk you through an abstract submission process using a dummy abstract. Well, I'm still working on the abstract, but I'll use it as an example to show you where are the loopholes where people often don't fill out or often don't complete on the abstract submission process. And then that's when their abstract doesn't get reviewed or by accident gets kicked out of the system. And then I'll try to answer some frequently asked questions that we often receive through email during the process of the abstract submission period. Okay, so just first of all, you should know that there are really two general ways. There's a few ways, but the two most common ways that people submit their abstracts for APHA is one, you go through the direct link that's provided by the section, caucus, SPIG, or forum. They usually have their own link that they advertise in their newsletters or their social media outlets about where you can submit your abstract. I have the one for the Latino Caucus at the top listed here. And then the other way that you can do it is just going to the main APHA website, their annual meeting webpage, which I also included there. The nice thing about this second link is that it'll allow you, when you click on call for abstracts, you'll be able to see the whole list of sections, caucuses, SPIGs, and forums that have a call for abstracts. So all of them will be listed there. You click on the one that you're interested in, and then you go through their submission process. It's the same software with each different section. It's just the call is going to be a little bit different, right? Like even though APHA has a common theme every year, so this year's is social connectedness, each caucus has also special sessions that they want to organize around a theme or a topic. So that's why I would encourage you to also look through through other sections, caucuses and SPIGs call for abstracts. But of course, I want you to submit to ours first. We're always looking for the hottest and newest research and interventions that are being developed for Latinx communities in the United States. Okay, so we have three different sessions that we organize. So first are the oral sessions. The oral sessions are small panels of 4 presenters and 1 moderator. When we were doing these sessions online through Zoom at last year's meeting, we also had a co-host. And so that co-host actually helps facilitate with the questions and, dealing with the audience in the virtual world. But typically we try, because we only receive 3 to 4 oral presentation slots a year, we try to reserve that for the most innovative research. And we also try to reserve those oral sessions for not just innovative research, but really also cutting edge intervention. So for research that's already complete also. And then we have our roundtable session with 8 participants, so 8 people presenting a paper or a project, and then they sit at a separate table, and then we rotate. So if it's in real life, we have people rotate across tables every 15 minutes. One of the things, or when you're like halfway through a project or even partway through a project, it's a great way to get feedback, interactive feedback from people at your table. And if we have it in a virtual setting, which we had one virtual roundtable session at last year's meeting, what happened there is that they basically organized it by having each presenter go to a breakout room on Zoom, and then you had other people join your Zoom room. And you still receive that interactive feedback that you would get at the roundtable session in person. So I'm a big fan of the roundtable, and we use a round robin method where we have people rotate every 15 minutes. You're welcome to stay at the table that you're at, but I think it's a really good opportunity to get at least 2 to 3 papers or 2 to 3 scholars that you can meet. And it's also a really nice networking opportunity for you as the presenter. The last type of session that we have at APHA and at the Latino Caucus, we get the most presentations are the poster sessions. So don't think, oh, I got a poster session. My abstract wasn't good enough for an oral. Don't ever think that. We just have the largest amount of slots dedicated to posters, and posters can be great opportunities for you too. I find that the posters are a lot of fun because you can actually have a really, again, similar to the roundtables, a really interactive session, getting advice and feedback, especially on works in progress. So don't think that either one is good or bad, but you do have the option, and you'll see that when I start the submission process, of choosing whether or not you want to do an oral or a poster session, right? So the oral is pretty much oral or roundtable. So you have a preference of indicating whether you only want to do an oral or whether you only want to do a poster. I usually typically choose no preference, right? Because I want to still have the opportunity to be accepted into the program. Yeah. So that, I think that's something else to keep in mind. So I would recommend that you press no preference instead of oral or poster. And always, you could write in your notes, I would prefer an oral, but I'm not opposed to a poster. And I'll show you that in a little bit. So just to keep some things in mind. So this year, APHA will be hybrid, meaning that we will have a group of people presenting in person, and we'll have an in-person conference, mind you, with social distancing and the proper public health measures in place. But we also have a hybrid meeting. So that means that we'll also have a virtual platform in which APHA will take place. This year, things were a little bit pushed back. So we typically have had our abstracts due in the middle of February, but because of the pandemic and because of the strain of actually organizing a virtual and an in-person meeting, this year's abstracts are actually on March 21st. So they're in the middle of March, which is nice. You have a lot more time from now until March to put together your abstracts. Okay, so before we continue with the submission process, I just want to briefly talk about how abstracts are reviewed. So just know that the scientific co-chair and myself, we do not grade the abstracts unless it's like an emergency or it's an invited session. We typically have a group of volunteers who review each abstract. So we typically like to have 3 reviewers per abstract score and review your abstract. And so basically it's a system of 0 through the score is from 0 to 45. And so as you can see here, the person not only provides an overall score, but they make a recommendation, the reviewer, and then they average the 3 scores into one final score. Um, what ends up happening too, if we have a plethora of abstracts, we end up deciding a cutoff point. Ours is very generous and lenient. We usually choose 27 or 30. We like to choose, we don't like to exclude abstracts. We like to be as inclusive as possible. But of course, we've had at some times, there have been maybe 3 occasions in my 2.5 years here that we've rejected an abstract because it was like not complete, or it was like a phony abstract. And then so that's the abstract that gets like a 5 or a 0, right? But I think the average score for our abstracts is about a 31. So that's something you should know. So don't feel like it has to be perfect. I mean, it should be a good abstract, right? It's being reviewed, but just know that our average is about 31, but an excellent score is in the 40s. So just know there are 3 people. We don't do it directly. It's blind and peer reviewed. And that there is also a cutoff. And just another thing too. So so I'll tell you now how each abstract is rated. So we have a few criteria that we are supposed to use. And this is a rubric that's created by APHA. It's not created by the Latino Caucus. So basically the abstract content, like, is it specific to presenting a topic? It must be of sound science, evidence-based practices, etc. And that they're not using, and that the person who's writing the abstract isn't promoting any specific item, right? Or any commercial entity. So that's really important too. The second piece are the learning outcomes. I'm going to give you some example of learning outcomes. So part of APHA's role as an organization is that they provide continuing education credits for medical students, for people who are community health workers, and also for other allied health professionals and nurses, etc. So as a result of that, each session has to have like a set of learning outcomes, right? And each presentation has a set of learning outcomes. And these learning outcomes have to be created in a specific way that demonstrates, that uses an action verb, and that fulfills the criteria for the session. So I'll show you that too. So we also grade based on the learning outcomes. What are people supposed to learn once they've seen your presentation? The other item that's addressed or graded is the gap that's addressed. Basically, what is the significance of the work that you're presenting at APHA? Are you filling a gap? Are you addressing a question that hasn't been answered before? Are you developing an intervention or strategy that hasn't been developed, or that's been modified and that would be applicable and helpful in Latinx public health, or even in other public health settings? You have to be really clear to address the gap. I even recommend underlining it. I like to really underline it in my abstract so that the reviewer knows, okay, this is why this is important. The fourth criteria that is reviewed is the competency. So did the abstract address a core competency in public health, nursing, or health education? In the notes of this specific PowerPoint, which will be made available on our website, I have a link of what are the core competencies for public health. There are about 20 core competencies, and so just make sure that your abstract addresses at least one of them. Most reviewers won't have the competencies like in front of them, but as long as you make sure that you address one of those competencies, I think you're good to go. And then, of course, the last item is the quality of the written abstract. This isn't a grammar test or a spelling test, but it does help, right? The more clearly your abstract is written, the less typos you have, the easier it is for your reviewer, who often has like 30 abstracts to review, to get through their pile. So yeah, so we also grade on the quality of the abstract. And then there are 3 recommendations that the reviewer has. They could either recommend to accept the abstract, recommend to decline the abstract, or waitlist the abstract. So if we have, for example, 3 reviewers per abstract and 2 reviewers recommend to accept it and 1 says decline, the person who says decline, I mean, for us as scientific co-chairs, like I especially, I want to make sure that I read the abstract over and I want to make sure that it's a substantiated reason. We typically accept most abstracts. The other thing is that if your abstract is waitlisted, That's not horrible. That's great. That means that we're really interested in presenting your work. We're just trying to find a space for you. And a lot of times towards the middle of the summer, or even toward as we get closer to the meeting in August, people drop out of the program. So that's why it's important not to feel bad if you're waitlisted, because it often means that you'll definitely make it into the program, most likely. This year we waitlisted 11, but about 5 people made it to the final program, half of them, or a little bit less than half, but it's because people decided not to present in the virtual platform. So don't think that waitlisted is a bad thing. It most likely will mean that you'll make it into the program. It's just that we may have too many, we have way more abstracts than we do places in the actual program. Okay, so what are best practices for APHA abstract submission? Oops, actually, am I supposed to do this? Yes. Okay. Yes. I thought I was going to do the demo first. So excuse me for not having that like all memorized in my mind. So the first thing is to read the call for abstracts for the particular section, caucus, SPIG, or forum that you want to submit to. I have here the link for the Latino Caucus's call for abstracts. The second thing is I would read the abstract submission instructions that are provided by APHA. Although I'm covering a lot of it here today, it doesn't hurt to read it. The third thing that I think is really important is that you provide a really informative title. Your title can actually do a lot of work for you, right? It tells us the population. It tells us what's the specific project or program you're trying to talk about. And sometimes it helps you knock out that background sentence in the abstract that gives you an understanding of of that specific area of research or intervention. The other thing is that remember these learning objectives I was telling you about for continuing education. I just recommend, if you can't come up with 3, because once your abstract is accepted, you could also develop a few more towards the end of the meeting. Just at least have one clear goal and learning objective in your abstract, right? And so other people have asked me in the past, do I have to just present research? No, we're totally open to public health practice, right? And implementation science. So what's happening on the ground in public health? As long as it's describing a process, as long as it's presenting lessons learned that can benefit other researchers, clinicians, or public health practitioners, that's worthy of presentation. So it doesn't have to always be research. One of the things that gets less traction, I think, at the meeting are literature reviews. So last year we did have one literature review that was submitted, and I think that they're valuable, but we put that one in a round table or a poster, I think, because, a literature review is helpful, but it's not reporting anything new in the research, or it's not addressing a gap necessarily. So just be aware of that. I think literature reviews score lower because they don't address a gap, and they're not giving people tools, right? They're not giving your audience tools. And the other recommendation that I have is have other people on your team or other people that you trust review your abstract just to make sure that it makes sense. Number 6, yes. So indicate the public health implications of your work. More recently, we've had psychologists and sociologists submit to the Latino Caucus, and we're super jazzed about having interdisciplinary, multidisciplinary work. Of course, it's public health. But at the same time, a lot of psychologists were very hesitant to submit to our section for many years because they thought, oh, my work is very much at the individual level or the dyadic level. It's fine if you have individual level or dyadic level research, right, or experimental research, but you just have to clearly indicate in your abstract what are the implications. Remember, just try to address one of the core competencies, right? Is it addressing something in population health? Is it promoting health equity? Is it addressing the social determinants? Is it showing a policy, right? The importance of policy, health in all policies, right? Just make sure that it addresses a core competency, and it doesn't matter if you're doing individual level work or dyadic work. Okay, number 7, please check the box to indicate if you're a student. Yes, so this is really important. You don't have to be a seasoned PI to submit an abstract. We totally encourage MPH projects that are really interesting, PhD students, and students working on larger projects with faculty to submit their own individual abstracts. In fact, we have a box that you check off, and we have an outstanding student paper award that we award during the the LCPH or the Latino Caucus award ceremony. And so I think that that's really important. It's a nice thing to add on your CV, and you get a small award for it. So take that into consideration. We love having students and young professionals submit their abstracts. This is a place for you to show your work and to, learn the ropes of disseminating scientific research. The other thing, yeah, I can't repeat this enough. Write one learning outcome, and I'll show you some examples of what those are. Okay, so basically the learning outcome reflects what the learner will be able to do as a result of participating in your presentation or educational activity. Each abstract has to have at least one single measurable outcome. And then APHA provides this list of verbs that they want you to use to start the sentence of your learning outcome. And if you don't use that verb, it kicks it back to you. Like the APHA complex system lets you know that you're not supposed to use that. So basically, don't use understand, knowledge, or learn as one of your outcomes, as one of the verbs or the ways that you start your learning outcome sentence, because it's going to kick it right back to you. It has to be a measurable outcome using one of these verbs that are listed here. And it's also listed on the website. So don't think you have to memorize this or come back to the PowerPoint specifically. Okay, the last thing, this number 9 piece is really important, the conflict of interest. So there's a conflict of interest form that you have to fill out when you're submitting your abstract, okay? It's basically saying that you don't have any commercial interest or there isn't any bias in you presenting this particular research, right? Not just you, but you and your spouse. And so in that conflict of interest form, you also have to indicate you have to provide like a few sentences or 75 words of an autobiographical statement specifying your expertise. You can't just say in that, I'm the PI of the study, therefore I have like the expertise, I can do this. No, you should say like, I've been doing this research for 10 years and I've created such and such types of interventions. I've produced this many like publications. They just need to see that it's a measurable outcome, that you actually have this many years of experience and that you have expertise in some area or more of research. Okay. So make sure to highlight your professional experience. No, don't just say I'm the PI or I'm Latino or I'm Latina, I'm Latinx. That's why I can do this. No, it has to be more substantial than that. And of course, just fill out every single step. And the nice thing this year is that I think there's really hard with this year's update in the software for you to actually miss a step and check off all the boxes, okay? Including the completion of the conflict of interest form. There have been so many, I think the biggest mistake that most abstract submitters do or presenters is that they don't fill out that conflict of interest form or they don't check off the proper box. And so so when you don't do that, what happens is that the system, without us knowing, the organizers knowing, the computer program actually pushes your abstract out and then you're not even reviewed. So this is one of the biggest issues we've encountered. So just always make sure you have one learning outcome and that you fill out your conflict of interest form. That's super important. Okay, so now I'm going to show you how we actually do an abstract submission using a dummy abstract, just for us to be able to show you that it's not a really onerous process. It's just more detailed. So I'm going to go ahead and try to share my screen. All right, let me see. Where am I here? Share. Okay, can everyone see that I'm on the APHA website? Can I get a yes or an amen, something? Can you guys see the website? Pietro, Pedro, hopefully. Okay.
Yes.
Can you?
Yes.
Okay, thank you. Thank you so
Yes.
much. I just need to know. Thank you. All right. So so what I'm doing is that I clicked on the first link, which is the Latino Caucus's call for abstracts. And so basically this is our page. And of course, the other page that I showed you in the PowerPoint was the main APHA annual meeting website. So the way that you would get to submit an abstract from here is clicking on call for abstracts. And then when you come here, this is what I was talking about, that you'll actually get a full list of all the sections, caucuses, special interest groups, AKA SPIGs, and forums that have a call for abstracts. And then you click on it and then you get to it. The other way, of course, is that you, let me see here. No, that's not it. I'm just gonna go to the Latino caucuses from here. I don't see it. Yeah, there we go. So you can click on that. This is our homepage for our abstract. So it's a long I apologize in advance. There's a very detailed call for abstracts, but it's just to kind of set up this year. So this year's theme is social connectedness. And even if you don't have a project that's specifically addressing social connectedness or social isolation, no worries. We accept abstracts in other areas too. Remember, we want to showcase all types of research that's either elevating Latinx public health and or contributing to the areas of Latinx health. So we also list here other topic areas that we always feature every year. So that includes chronic disease prevention, research and interventions. I forgot to add infectious disease, but we definitely accept that too. Honoring the work and legacy of Edna Viruel Fuentes, who passed away last year. She was a really big, she was really a big star for social determinants of health in our field. Improving the built environment to promote social connectedness. Of course, if you're part of the Latinx Young Professionals, right? We want to feature your work. Actually, the Latinx Young Professionals, I forgot to mention, have their own poster session at APHA. So if you indicate in the comments to the organizer that you are part of Latinx Young Professionals, we always take you into consideration, and we always try to find a place for you in the program. And of course, so in the submission process, you could indicate, you could do any other topic. New and emerging issues in Latino, Latinx health is always a safe bet. If you don't really know where to organize your abstract, just put it in that pile. We usually will end up finding a place for it. But yeah, so even if you're not submitting an abstract that's directly connected to this year's theme, that's fine. We totally will consider it, and we will find a place for it in the program. And then so, okay, let's say I want to start the abstract submission process. I click on that link there, and it takes me to the APHA Confex system. So like I was saying, so it says here, first step is to select the topic. So remember I told you we make up these Mickey Mouse generic ones. So my particular abstract that I want to submit today is related actually to dyadic analysis, right? I'm starting to do more dyadic analysis, or analysis between parent and youth Latinx dyads. So I'm going to put this in social connectedness or social isolation resulting from institutional practices or policies. But remember, if you don't know where to put it and you're not in these other areas, just put it in new and emerging issues in Latinx health, and we'll find, we'll be able to organize it. Okay, so save and continue. And then the title. So this is where I said that you can use a very informative title for your abstract. So what I often do and what I recommend is that you start your abstract submission process in a separate Word document. So that's what I did today. I started the process in a separate Word document, because if you started on the APHA Confex system, and let's say your internet, you lose internet connectivity, then it often saves the work that you've done, but it won't save anything except the last page. So you just want to make sure that you have it in a separate Word document. So here's an example of the title. It's the effects of structural and interpersonal forms of racism on Latinx parent teen dyad, salivary alpha amylase, cortisol, and uric acid. Okay, and so just be aware that just the first letter is capitalized and the rest of it is lowercase. Then for the abstract, the submitter email, so this is the person who's submitting it, I put my email address. It remembers me because I'm on the system like every day. And this is what I was telling you. What kind of presentation format do you prefer? So I recommend, so if you're really gung-ho on doing oral, then press oral, or oral preferred, and then there's poster only. I usually put no preference for mine, just to make sure that I make it onto the program. And now this year, this is a new question, because we're having a hybrid meeting. Do you want to just do virtual only? Is that your only option? Because maybe you are, in a high risk category, or you can't travel for other reasons, or do you prefer only doing it in person? For some of us, we have to do it in person, right? For us to be reimbursed for our conference registration fees. So what I'm going to do is this. So what if you say, I want to do in person only, but you're open to being part of the virtual program? Just make sure you put it in the comment to organizers. I am also open to presenting in the virtual program or the virtual sessions. Yeah, so that way you press in person only because it indicates that that's your preference, but you don't get completely thrown out of the of the meeting, right? We still consider your abstract. And then this particular question has to do if you're promoting any type of unlabeled use of a product or some products, like especially for people who are experimentalists. If you're actually experimenting a new, like for me, for example, I use a lot of salivary biospecimens, and my collaborator, he's one of the owners of Salometrics. So in the past, if I'm testing a new assay or something for him, I have to indicate that I'm actually using something off label, right? But most of us don't often have anything to report here, so leave it blank. Like we're not trying to promote or market any other devices or products. Okay, so then make sure you press save. That's super important for each page that you press save. Okay, so now you have to select learning areas. For this one, I'm just going to say public health biology, social chronic disease management and prevention, and social and behavioral sciences. You could press whatever one you want. You can choose up to 6 learning areas. But just for the interest of time, I'm going to go through this a little quicker. Okay, and then the health indicators. So this helps the executive board monitor if the association is actually achieving their mission and vision of creating a healthiest nation. And basically it's listing, like really what it's listing are social determinants of health. Okay, so my particular abstract, I'm looking at educational opportunities as a form of structural racism and racial segregation. So I'm going to press social determinants here. Um, let's see what else. And I could only choose 3 in this area. And I'm going to do social support because I'm also doing a dyadic analysis. But you choose the ones most applicable to the abstract that you're submitting. Okay. And now, ooh, this is the section where a lot of people make a lot of boo-boos. Okay, the learning outcomes. So remember, the learning outcomes are for people who are going to APHA for continuing education to be able to say that, that they're actually going to learn something, from the presentation or from attending that session or panel. And I would say that not only is this really important for the continuing education goals for APHA, but it actually increases the attendance at our sessions, right? Because people will come to your session because they're going to learn something that'll help fulfill their continuing education credits. So I really strongly advise you to do this and to do it thoughtfully. So as you can see here, APHA notes that you should use that when you create your learning outcomes, that you should use one of the following verbs, right? Analyze, assess, compare, define, demonstrate, etc. And it's very strict about that. I've already created my learning goals separate, my learning outcomes separate. So the first one that I decided to do was, and it could be really simple, define structural and interpersonal racism. So then that's not the only thing I want to do. I have another learning outcome for this specific abstract. Evaluate how structural and interpersonal racism are related to Latinx parent adolescent health. So I copy and paste it from my Word document. And then I have a third learning outcome. You can have up to 3. The third one that I'm copying and pasting is differentiate how structural and interpersonal racism are related to stress and cardiometabolic risk. Oops. I already did that. Risk on Latinx parent and adolescent dyads. Okay, so I'm done. I have my 3 learning outcomes. And I used the verbs that they have here that I should start my learning objectives with. And so I save and continue. And if I don't use those verbs, it shows that I have an error. So, okay, I did it right. So add authors or add people is a section where you're going to add your co-authors or your other team members who helped you produce that abstract or that research, right? And so it's recommended that you use an email address that person, that your co-author will use for registering for the conference. So but when you're producing your abstract in the Word document, make sure that you have all of your authors' full names, their degrees, and their affiliations, so you can be able to fill that out. And make sure that you have the email address that they plan to submit that they plan to register for the conference with. Okay, so I'm going to use 2 dummy emails. I'm going to use the Vice President of the Latino Caucus and Scientific Co-Chair, Barbara Vaquero, as one of them. And because she's an active member of APHA, it found her immediately, and I can select and add her as a co-author. Okay. And then I'm going to add another person. I'm going to add Andrea because why not? As you know, why not? She's, as an example of another person that I can add as my co-author. Okay, and it found her. See, it found her. UC Berkeley School of Public Health. And so I select her. And then when it comes to this list, like it's producing a list of all the authors, right? You need to indicate who's the presenter and who's the author. Um, because I'm the person submitting it, I'm going to add myself actually. Yeah, because I'm the person submitting it. So you do have to add yourself again here. If you're the person that's submitting it and also wants to present it. Okay, and so I want to indicate that I'm the presenter. Yes, okay. And it'll notify that person immediately that they've been added as the presenter. You could change the order of people using these arrows and you could delete them. You could be like, bye. And even later, it's like, let's say someone doesn't want to be a part of that paper. When your abstract is already submitted in the speaker's corner, you could modify the order of the presenters. You could change who will be the presenter for that abstract too. All right, next step, conflict of interest. The other place where people often make errors or commit errors in the abstract submission process. So you see here, it looks like, oh, I don't have to do anything, bye. No, you actually have where it says the presenter, right? You have to fill out the conflict of interest form. So you click on not completed. That's where you're going to fill out the actual conflict of interest form. And this is really important. Don't think, oh, I don't have anything to do here. No, click on not completed, the highlighted link there, because it's going to take you to the conflict of interest form. I don't know why they just don't put, why they just don't click, like put conflict of interest form, fill out now. Okay. So it discusses here, like, what is a conflict of interest? Like basically that you're either promoting a commercial entity, a pharmaceutical or biomedical device, or that, that there's a conflict of financial interest in the sense that you're receiving funding or direct payment from a third party entity, a commercial entity specifically. So for this particular project, I'm not actually collaborating with Doug Granger, who's the owner of Salametrics. So I'm going to say no. Right? So during the past 12 months, have you or your spouse or partner had a financial, professional, or personal relationship that could potentially bias the impact of the work that I will present? No. And then here's that qualification statement where you actually get to write, like, you don't say, I'm qualified to present this because I'm the PI. No, you're going to write your experience. So let me move this out of the way and get back to my Word document where I have all this stuff saved. Okay. So you basically write a 75-word statement or less indicating why you're responsible for this content and what makes you the expert. So here I just simply write, I'm qualified to be the abstract author because I have over 15 years of experience conducting research, blah, blah, blah. I've designed, executed, and published research examining the relationship between X and Y. And I've actually gone under the word limit, which is, 75 words is really generous. You don't have to go crazy. 2 sentences is just enough. Just make sure you can quantify it, how many years and what you've done. And then it asks you to type your signature. So I just basically add my name. So important, if you're submitting this abstract on someone else's behalf, like the actual PI of the study, enter their name below. Okay. Not the person who's submitting it. Like if you're the RA, make sure you enter their name, the person who is the lead on who's supposed to be submitting the abstract, right? Because a lot of us do this for other people or PI. So of course, save and continue. So yeah, when it says completed here, that means you're good to go on your conflict of interest form. And now it gets to the good part, the actual abstract, right? So the most important piece to know is that it can only be 250 words or less. And the most important thing you should know, you don't have to add any indicators like background, method, results, conclusion, or findings. You just have to add the text in a block form. You don't have to include the title, right? Because you already did that earlier in the beginning of the submission process. You don't have to include your co-authors. You don't include, for sure, trade names or any commercial entities in your abstract. And you don't have to start it with a label or a header like abstract, okay? You just have to copy and paste the text from a prepared, the text from another prepared word processing software. So I'm going to go ahead and copy and paste that here. And what else you should notice here is that you have a little bit of HTML ability to format your abstract. So remember what I was telling you earlier, that it's really important that so one of the criteria that you're evaluated on is if you've addressed a gap. And so in this example here, I love to underline, like I always recommend this for anyone, just underline why, what's significant about your research. What gap are you addressing? So here I did it. I just told, I told my reviewer, a few studies have examined chronic racial stress. Hello? Can you hear me? Okay, sorry. So that few studies have examined chronic racial stress in relation to Latinx physiological health, blah, blah, blah. And I made sure to underline it so that my reviewer knows, okay, this is the gap that I'm addressing. And I like to add numbering in it so that they know I'm doing 1, 2, and 3. I underline also the methods, like I'm using repeated measures, mixed method study, integrating 3 data sources, so that it's very easy for my reviewer to know what I'm doing, what gap I'm addressing, and that it's an organized abstract, okay? Okay, so so I'm exactly at 249 words. So just notice that it actually indicates to you how many words you're at. So I'm just almost breaking even here. Yeah. Okay, so save and continue. This part takes sometimes a little bit of time. Okay, and you're almost done. Your abstract has been received. Yay! Okay, so then on March 25th or March 31st, reviewers will start reviewing your abstract. And it won't be until July that you actually know when your abstract will be
Julian's waiting for you.
Uh-oh. If someone can go on mute. Okay, so just something that you should realize. You know that your abstract submission has completed by 2 ways. Number 1, you have this final page that says your abstract submission has been received. It has, I would review it really quickly, make sure that the authors are correct, the title is correct, your abstract content is correct. Your address, your email address, please make sure that that's correct, because if it's incorrect, then it's going to keep going to some other place. It has all the information that you've summarized or that you've entered previously summarized here. The second place where you're going to know whether or not you've submitted the abstract is on your email, right? So you're going to receive an email from APHA indicating, hey, we got your abstract. So just make sure you receive that. So see, I received an email from APHA saying, thank you for submitting your abstract. And this is great because you're going to then receive an abstract ID. And this is how you're going to communicate to the organizers, whether you have any questions about your submission, whether you want to remove your submission, etc. So always know that you get a confirmation email on top of that last page that we just noticed in the abstract submission process. So, okay, we're going back now to the PowerPoint. Recent.
Thank you so much, Heidi.
Oh, I'm almost done. I have only a couple more
know.
slides.
No, I'm just saying that this has been so wonderful. I just wanted to say that.
Oh, okay. Thank you. Okay, now let me go. Let me jump. Okay. Okay, best practices we went through already. Hopefully I demonstrated some examples. Okay, so, all right, so we'll go here. So of course, what I just showed you was evidence that that your abstract has been submitted and everything is complete because all of the items on the top bar are highlighted in blue. Oops, I think my slides are going cuckoo. Okay, one more slide and we'll be at the right place. All right, the most important page, that your abstract submission has been received. And remember that when you're communicating about an abstract that's been submitted, whether, oh, I forgot to add something, oh, I want to remove my abstract from the program, whatever it is, that you communicate with this ID number that's located both in the email and on the upper right-hand corner of your submission, okay? And always use this to communicate to APHA or the session organizers about the abstract ID, okay? So that's how you know that your submission is good to go and that you've done everything correctly. So now I'm going to come to the point of frequently asked questions. Okay, so I showed you some nuts and bolts about how to submit your abstract on the APHA complex system, what are common loopholes and mistakes that people make in their submission process. But then also I have some frequently asked questions. So feel free to come back to this PowerPoint if you do have those questions. But the first question I think I addressed in the earlier part of the presentation, but must my research project, intervention, or program be complete by the time you submit your abstract? No, you can submit works in progress. I'm sorry. Just clearly indicate in the notes or the comments to reviewer that your findings, that you're going to have like your findings at the end, that you're going to report at the conference just works in progress. If your research project, intervention, or program is not finished or is ongoing, just indicate in your abstract or in the comments to the organizer or reviewer that you're showing lessons learned or works in progress, and that your project doesn't have to be completely done. But what I don't want to see, and this is what's like disappointing, is like you only have 12 surveys of the 1,000 that you need to collect. Unless you have something lessons learned about the process, about what could have improved it, then don't try to present the scientific results as generalizable when you only have so few, right? But you can still contribute in showing like what you've learned in the process and what you're going to do better or what could be beneficial to others. Okay, do I have to have an active APHA membership by the time I submit an abstract? No, you don't. But by the time your abstract is accepted, the presenting author must become an individual APHA member. Okay, so just the presenting author, and they must register for the annual conference by the 31st of August. Okay, if you don't, then your abstract will be withdrawn. The third question I answered earlier, but just in case to reiterate for anyone who came to the call late, must my research project, intervention, or program to APHA be related to APHA's conference this year, social connectedness? No, we encourage you to have scientific work and sessions that are dedicated to the conference theme, but APHA is a space for new research, right, and new public health projects. So if you're trying to address the public health issue in the Latinx community that directly affects or is related to Latinx populations in the US, we totally consider it. And we're being very lenient and we're taking a very broad approach to social connectedness and social isolation. So don't think that you have to have a social networks analysis for this. No, we're taking this, we're thinking about it in all types of ways, the digital divide, virtual settings, etc. Relationships. The fourth question that we get a lot is, may I submit an abstract that's already been presented at a previous conference or that's been published? Unfortunately, no. Abstracts that are submitted and accepted to APHA must be new work that has not been presented at other conferences or has not been published prior to the October 23rd meeting. May I present the same abstract at another APHA section, SPIG, caucus, or forum? Unfortunately, no. You can present a different aspect of the same project, but it can't be the same identical abstract. So you can't, and you should know also that you can't present more than 3 abstracts during an APHA meeting, okay? And that each has to be different. So the sixth question that we get a lot is, I didn't receive funding to attend the APHA annual meeting in Denver. Can I withdraw my abstract? Yes, you can withdraw your abstract. But before you consider doing that, you may want to contact the organizer, myself and Barbara, and ask us whether or not we have room for you in the virtual program. So just find out if we have room for you in the virtual program. The other thing too is that if you withdraw your abstract more than 2 times in a row within a period of 5 years, you actually are you're put on an exclusion list. Okay, so just be aware of that. Like, we know emergencies happen, right? So just be aware of that. Like, if you're constantly one of these serial withdrawers, then that puts you in the no-go list. The last question, may I contact the scientific session chairs listed as program planners on APHA's website? Yes, of course you can. But before you contact them, just know a couple of things. We can't directly review your abstract for acceptance. Like, you can't email it to my email address and then say, oh, can you review my abstract? I can't necessarily do that, right? It has to go through the peer review blinded process that APHA has set up. The second thing, though, that you should know is that, you could always ask us questions, though. Like, if you don't really know if you're a good fit for this year's meeting, if you want to ask questions about the format of our presentations, or if you're a good fit for the caucus's call for abstracts, just email us. Of course, we're happy to give you any clarifying any advice to submit your abstract and any clarification that you have about the process. That's what we're here for. But we just can't directly grade your abstract and say yes, yay or nay, or wait list, okay? So of course, if you have any questions, feel free to email me. My email is there at admartinez@umass.edu. And you could also see my email in the program planning or APHA annual meeting page that I showed you with all of the caucuses SPIG sections call for abstracts. So it's listed there as well. Last but, oh, that looks really funky. But basically, oh, the last announcement that I wanted to make that doesn't really show here is that let's say you're not ready to submit an abstract, you're not ready with your research. Well, another way that you can participate in APHA, there's two other ways that you can participate in APHA. Number one, you could become a reviewer of abstracts. We're always looking for volunteers to review abstracts, and you're only going to review abstracts in your areas of research or expertise that you're comfortable with. So the deadline to volunteer for that is March 25th. I believe. So if you want to sign up, you can sign up. I have the link in the PowerPoint. The other way that you can contribute to APHA is to become a moderator or a co-host of the session. You know, that's always a great way to contribute in national service, to the discipline, to the Latino Caucus, and to APHA. So these are other ways that you can get involved with the Latino Caucus in the scientific sessions. But the call for moderators and co-hosts, that doesn't happen till later in the spring. So you don't have to worry about that. But right now what's open are the call for abstracts and the call for reviewers. So if you're really interested in reviewing abstracts, think of it as an opportunity to know what's hot and what's happening in the research world around Latinx population health and public health. So yeah, that's a good opportunity also to add to your CV some national service. Yeah, so thank you so much. I hope, I've answered a lot of your questions and that you found this helpful. Thank you.
I was on mute. Thank you so
You're welcome, 850.
Thank you so much, Irene, and all of those who came and attended. If you have any questions at the very moment, please share your questions. We would love to have the conversation about what Irene just presented on. That every time that this is the second time we've done this, and each time I learned something new. So thank you so much, Irene, for sharing that.
Oh, you're welcome. I'm sorry. I feel like it's one of the driest presentations I give about, but I'm really happy you invited me because this got me out of wearing pajamas all day.
No, we really appreciate it. I'm sure that those who couldn't attend but will still watch the recording will also really appreciate it.
Good. I'm glad. I mean, you're a veteran too, Pedro, so I'm pretty sure you've done this before.
Yeah, but every conference system uses a different submission system, so it's always helpful to get a refresher. Yeah, totally. So thank you.
Yeah, no, and you're welcome. It was nice meeting you.
Well, I'm
Any
gonna
more
go,
questions?
but I'm
Okay,
gonna
yeah,
go,
sure.
but I look forward to submitting something. So let's, thank you again. Take care.
You're welcome. Bye.
Bye.
Thank you for attending this year's How to Submit a Successful Abstract. We will show more LYP connections throughout this season, through the spring season, and just check back with us next time. Thank you. Bye-bye.